Just how concerned should we be about the 2 human cases of bird flu in Cambodia? We know they occurred in the south of the country, in Prey Veng province. An 11-year-old girl died and her father also tested positive for the H5N1 virus, but he's well. Genetic testing identified the girl's virus as an endemic variant called 2321C. But the scientist leading the analysis has now told Sky News that the bird flu virus had mutations that helped it adapt to human cells.
There are some indications that this virus has gone through a human. So what we have to understand is that when a virus gets into a new host, they are very promiscuous, they change very quickly, and they do adapt.
But that doesn't mean the virus can spread between people, at least not yet. It latches on to a type of cell receptor which is only found deep down in our lungs. For it to transmit easily between people, it has to mutate to target a different receptor found on cells in our nasal passages. That's what regular winter flu does. The cells are not only easier to infect, but a cloud of virus is released with every breath. But Dr. Karlsson warns the world must closely track the virus and work on test kits and vaccines just in case it changes.
It is concerning that it's gone global so quickly, and I think the entire influenza community, as well as the public health and animal health communities, are quite concerned about it. Obviously, in the UK, in all of Europe, as well as North America, South America, there's been massive poultry infections, there's been spillovers into mammals, and each one of those spillovers into mammals is a concern.
Here, the UK Health Security Agency reported a human case of bird flu in January 2022. And so far this winter, there have been more than 3,000 exposures to the H5N1 virus in people working closely with sick birds. None of them tested positive. Health officials are also analysing a small number of samples taken from patients with flu-like symptoms to check the virus isn't spreading below the radar. It's not just Cambodia at risk. The next pandemic could start anywhere.